Thank you, everyone. And isn't it just so fantastic to be in person again? The first of these I've done without having to be online and pressing buttons and sharing slides. So lovely. First of all, I'd like to just have a shout out to the nurses and midwives in the room. Hands up if you're a nurse or a midwife in the room. Yay, thank you. Brilliant. Okay. So this isn't just for you. This is actually to give some of your messages to everybody here today. So let's actually just have a bit of a think about where we're going from here. I'm going to talk a little bit about the NIHR, because that's obviously who I work for, and the footprint that, as we've envisaged it in the nursing and midwifery team, and also some of those challenges for research and who we need to be working with to get some of those things happening. Some insights into research delivery that we didn't have certainly at the last of these events that you would have attended, and then our own plan for this. But finally, what's the most important part here is to sort of increase the likelihood that research becomes everybody's business. You know, eventually we hope to have a statement from the Nursing and Midwifery Council, similar to that put out by the GMC recently. Mark Radford and I were talking about how we're going to move that forward. But the bottom line is we want people to be offered the chance to be introduced into research studies, don't we? And that's what we're all about. So in terms of the NIHR, this is not an NIHR official slide at all. This is how I understand what the NIHR actually does. Before I came into post, I'd sort of dabbled in various bits of this complicated map. But essentially, the NIHR supports people, it supports studies, it supports sites, it provides amazing infrastructure, and you guys here are absolutely the core of all of that. But also, the NIHR is about spread, and parts of the NIHR, like the ARCs, are really key here. So whether we're thinking about those personal awards, career opportunities for people, or whether we're thinking about how we get the message out from the studies that are actually conducted so we reduce that research waste that we're all quite passionate about as well. What we're also really keen on, and Louise has touched on this, is that this pipeline. You know, how do we bring along the next generation of people? How do we work with our undergrads to make sure that they actually see research as a potential career for them? Not just academic research, but actually delivering research as an option. We need more placements, all of those sorts of things. We'll come back to that shortly, but it is about that pipeline. It's about the pipeline of people. It's about the pipeline of sites. How do we warm new places up? We did it, didn't we, during COVID? Wards got engaged in research that had never, ever recruited patients into anything before. So we need to keep that momentum going. And actually, how do we get that pipeline of studies happening? So from the point of view of NIHR Nursing and Midwifery, we're here to provide that sort of professional leadership, if you like, across all of this. In a way, we have some carrots, and we don't have any sticks because we're not actually responsible for anybody. It's a very interesting job, I must say. I'm thoroughly enjoying the job, but it's in some senses the strangest job I've ever had, because there's lots of leadership and not so much management. It's really interesting. But actually, we are in a very unique position in that perhaps what we're trying to do is also join up some of those things. So the discussions I was having around the edges of Strategy Board last week were very much about how do we get research delivery nurse input into funding programme boards. And so we're meeting with the programme directors to say, actually, we need to make sure the studies that get funded are actually deliverable. And you guys here are the ones who've got the answers to those questions. So that's very much on the horizon at the moment. So in terms of our overall footprint, there are some people it's very easy to see that they're clearly in our footprint, people who've had grants, people who've had personal awards, both through things like the ICA, the Integrated Clinical Academic Pathway, but also what we colloquially refer to as the 70 at 70, and we'll come back to that again in a moment as well, but also the research champions who are working in different parts of our footprint as well. And you'd think we could find these people. Well, some of them we can find. Trying to find nurses and midwives who've been awarded grants is a bit of a nightmare because actually we don't know the professional background of the people who are the CIs on grants. So we're working again within the system to try and make that a bit more obvious, just so that we can join people up, because we can't do that across the whole piece thing if we don't really know who's out there. But also, there's a great big blue box there for people involved in research delivery, because we feel that this is really a really important part of our footprint, hence I'm here today. But again, actually finding people in the different parts of research delivery. From the outside, before I came into this post, I thought it was all actually quite simple. And of course, you get in and you find that actually, no, it's not at all simple. And the people who've worked here for 10 years are going, no, it's not simple to us, and we should know. But it's really just trying to find people, not just only to say, hi, we're here, but to say, actually, what do you need us to be doing? And again, we'll come back to that in a moment. But if you think about that, what we're also looking at is not just the people who are currently doing these things, but we're also interested in the people who've done them before, so people who've had personal awards, people who've moved on to other things, because actually the NIHR tries not to let go of anybody, and so we need to do our bit there. But the key is that box in the green, the people who are aspiring, the people who think, I wonder if I might be interested in this. How do we free things up so people can come and have a taster of research delivery and say, oh, actually, this might be really good, or even better, get the managers to come in and have a taster of research delivery so they can inspire their staff and work out how we can do all of this. But we're also really interested in those people who've never had a bean of NIHR money, the people who are working in roles where research is in their job description. I would say for quite a lot of them, it's in their JD, but not in their appraisal necessarily, and that's a huge gap that we're very aware of. There are lots of clinical academics who are not NIHR related. We don't own that title at NIHR, but there are people in advanced clinical practitioner roles and consultant midwives, consultant nurses who got research. So we need to be working with these people much more clearly, because I think they've got the potential to come into the blue boxes, and in particular to come into this blue box up here and help you with research delivery as well. Later in August, I'm going to speak to a group of ACPs up in Lancashire, East Lancs, I think it is, I'm going to Blackburn, to talk to them, because they want to know, how can we get more involved in research? How do we get that pillar of our job description working? So before that, I'm hoping to speak to research delivery people to say, right, how do I link you in with these people who want to do research? Because you're part of the answer to that. So that's just one example. So in terms of actually where we sit, there are lots of challenges. One of the groups of people I meet with most regularly are Ruth May's office team. I meet with Mark Radford. I'm on the delivery board for Ruth May's strategic plan for research, because actually you've got vacancies, but there are vacancies across the whole system. There are lots of challenges. People are leaving. You know, people are not retiring and returning, they're retiring and going and never wanting to darken the doors again. And we've got to work out if we've got some solutions to that. How can we help people to think differently about their careers? But there's also that whole sense of invisibility of research in job descriptions. I talked about those 3 purple boxes, but actually generally research isn't in people's job descriptions. So how do we actually get more of that happening, and who do we need to talk to? We're working with the Florence Nightingale Foundation to run a sort of a residential school for chief nurses of trust, to really get them to get it. This is what research is. And we'll be presenting them with sort of case studies of research delivery, different parts of research, to say, this is what you should be doing in your trust. This is the potential you've got. And in particular, people who are postdocs, actually, this is what you should be doing. This is how you should be using these skills. And so, again, yes, I've already touched briefly on number 3. The full range of expertise that nurses and midwives have got isn't necessarily used when people move into research roles. We'll come back to that shortly in relation to a particular area of work we're doing. But there are also geographical disparities, aren't there, in research opportunities? I was absolutely thrilled when I got this post, because I am from sleepy Devon, you know, and I live on a farm west of Exeter, and actually, yet it was felt that I could do this. And there's something we need to do about levelling up, isn't there? We need to make sure that the opportunities we've got really do reach everyone, and that we actually do look at those in a proper EDI inclusive way when we look at where we actually place those awards and things. We're also very aware that there's a low aspiration in the integrated clinical academic pathway. We know that actually nurses and midwives are as successful as anybody else. The success rate is sort of late 20s, and that's no different from our medical colleagues. But actually, the numbers that apply, particularly for the doctoral fellowships, they're down to single figures, and that is bad. So we need to do something to say, actually, you can do this. Are the rungs missing on the ladder? Do we need to do something different in that way? So again, we're working with a range of different people to try and see how we can do this. But in particular here, from your perspectives, I'm really, really concerned that if you're a research nurse or a research midwife, the success rate is quite a bit lower. And so there's something that we, particularly I, need to do to change that. Because if you're in research delivery, then absolutely you should be aspirational into moving into clinical academic type roles. Why not? And so we need to think about how we do all of that. But also those post-award opportunities. You know, even when people have had an internship, they just go back to their job. And that goes all the way through the clinical academic system as well. So those are the sorts of things that we're particularly challenged about. But we have 70 senior nurse and midwife research leaders who've just graduated from the Senior Nurse and Midwife Research Leader programme, and I know some of them are in the room today, so hopefully you might get alongside some of those a bit later. We do have future investment, and again, I'll talk about that in just a moment. We do, though, at the moment have a clearer picture of clinical research nurses and midwives. We didn't know some of this stuff. We know more than we did, and it'll be interesting to see what comes out of the workforce survey. Some of you will know that there was a self-report census conducted last year, and that was a huge collaboration, and thanks to everybody who got involved in that. And we found some people. Now, you might think, well, we know there are more people than this. Absolutely we do, but we didn't know how many people we'd got before, and any of the previous estimates were lower than this. So at least we kind of know that anything moving on from this is going to be more than that. So just thinking about actually where are people working? Well, a lot of people reported they were working within a particular specialism. So they were a cardiac research nurse or a respiratory research nurse rather than working generically. These sorts of things are actually important indicators if we're thinking about the future of research delivery roles and if we want more generic roles, because if this is where people say they're working at the moment, that's a piece of work to be done, or maybe we shouldn't be doing that. So there's things there. Anyway, there's papers coming out in relation to that. So look out for those. The careers initiative that the NIHR Academy ran showed us that there are a number of strengths, challenges and solutions for particularly people working in research delivery. The interesting thing here, and this was a survey that again went out last year, I think it went out before I came into post, but this was about trying to work out what can we do differently for careers for people working in research delivery. But the interesting thing is that the themes that came out were the same for solutions as they were for challenges. So in other words, for every challenge, somewhere had found a solution to that challenge. So there's something we need to do differently about just joining people up and saying, but you can make this work. It might be a challenge in your place. So maybe people like me need to work at that chief nurse level to say, why aren't you doing this? There's things that can happen here. So we need to find a way of celebrating so that people are saying, oh, so why aren't we doing that in our organisation, and really galvanise people in that kind of way. And we're also very aware, though, that one size doesn't fit all. Where nurses and midwives are engaged in research in the secondary care system, there's a lot more visibility. But when we move into community and out of hospital systems, it's totally different, isn't it? An ACP or a consultant nurse is working on their own quite often with a patient and family. So working on that notion of you've got to see it to be it, people aren't seeing it. And even the idea of how research delivery happens, clinical staff are not seeing research delivery in those systems in the same way as they do in hospital. And so we know that we need a very different approach. We need to think differently about how we support people coming into the Senior Nurse Midwife Research Leader programme if they're in community settings. Where do they get their support from? How do they even know that the opportunity is out there? So in terms of our plan, there are a couple of things that we're really aiming for. The NIHR works on business plans. So Ruth May has put out an amazing strategy with areas of work. Our work feeds into and feeds out from that work. So it all interfaces, and Alison Richardson and Joe Cooper, who are the real kind of drivers behind that work, are very engaged in the stuff that we're doing. But there are two things we're wanting to do. And one of these, which I feel really very passionately about, that nurses who support, deliver or lead research are equally valued. You know, people aren't seen as going over to the dark side when they move into either of those areas. But also it's really important that people can develop their potential and that they can work to the potential they've already got. So that's sort of our first aim. And then the second comes back to that very first slide about pipelines, delivering pipelines of research active nurses and midwives who can support, who can deliver, and who can lead research. So what are we doing? Well, we've got 6 projects underway. The first of these is about career pathways, and I think Cindy's probably in the room somewhere. Cindy's over there in the middle of the room, and Cindy is leading this particular piece of work for us. We're developing career pathways, particularly for those of you who put your hands up earlier in the room. This is actually what do we need to do to give you a career pathway so that you can actually see some progression, so that we can present this then to managers within your trust to say, but you're a trust without career progression. What are you doing? No wonder you lose people. All of those sorts of things. We also want to identify what makes research roles successful when they're in out-of-hospital settings. This is actually quite a huge piece of work, but we want to know what makes things work before we can work out what we need to do next. We're also developing a PI pipeline program for nurses and midwives, again, because we know that if you're in research delivery, you don't have access to the API scheme. We're not just interested in APIs, we want PIs and CIs, and so we're looking at the whole pipeline. So that's the third of our projects. And then we're looking at continuing the 70 at 70 program, the Senior Nurse Midwife Research Leader program, and actually looking at how we optimize the spread of that. And also, fifthly, looking at how ACPs can use their full range of skills when they come into research delivery roles. You know, what is it that stops them being able to prescribe something they can do on their clinical day, but they can't do on their research delivery day? What's the sense in that? So we need to really tackle some of these things. So we're working with ACPs in research to really look at what we need to do next. And then looking at promoting research nursing and midwifery as a career, both with undergrad students, but across the whole range of experience levels. And I've already mentioned Cindy, and we've also appointed Sharon Dorgan. I don't think Sharon's in the room. Sharon works for one of the LCRNs, but she's leading the PI pipeline program, the PIP, and Louise Wolstenholme is leading our project on research roles in out-of-hospital settings. So making research everyone's business is really what the aim of all of this is, isn't it? We need more people engaged. We need clinical people to think research. We need to refer to research in the same way as they might refer to the physio or the OT. That's really important. And just some examples of this and things that have already happened. And actually this first community research hub that was set up by Helen in I always get the R-dash bit a bit wrong, but it's Rotherham, Doncaster, and that kind of way, isn't it? But actually, this is amazing work that's gone on to take research out to people in a different way from the research buses. This is actually a proper hub. So I would encourage you to find Helen online and sort of have a look and see what they've done, because the achievement there, increasing recruitment to portfolio studies and increasing involvement for research nurses working clinically is really important. And Deep Sea's work, which was shortlisted for the Nursing Times Award last year, where she actually increased study reach into ethnically diverse communities, and that then aided recruitment into UK Reach, and they became one of the top recruiters. And this really simple idea up in Lancashire for actually just putting a research board outside each ward area so that visitors can see, Anyway, you can see what that's all about. And I think these simple solutions actually can really make the difference, can't they? So there are common themes here. All of these initiatives are about research being everybody's business, but a lot of them are about cutting out the middle person, the folks that get in the way of that actually happening. But that shared responsibility too, that actually both ways have got a responsibility. But embedding research as part of care, that's really where we want to get to, isn't it, for the whole system? And thinking of research as an opportunity, not an added burden, and who's best placed to do this. Thinking about equality of opportunity and whether there's any inbuilt bias. And I would just end with, actually, you know how best to do this in your organisation. So I would just end by saying, just please do get in touch. Feel free to come and find me. You know this is what I'm wearing today. You know, come and have a chat or get in touch with us. My last time in this building was for an RCN Congress, and the microphone stopped when the red light came on. And that hasn't happened, so thank you.
So, has anybody got any questions for Ruth? Please do come to the microphone so everybody can hear you.
Thank you so much for your great presentation. Is there a similar plan for allied health professionals?
So we're working on what needs to happen for allied health professionals. For example, with our senior nurse midwife research leaders, when we start our new programme next April, we're going to have a stream of work running alongside to say, what does this need to look like for AHPs? A lot of what we do is actually much more inclusive than just nurses and midwives. So we don't deliberately exclude, but there are certain programmes that have criteria. But yeah, there's lots of work underway.
And could I ask? Kimo, could I ask you one question? In medicine, there's colleges and trainers are trying to work out how to integrate research into training for people working in the NHS. Is that part of the plan for nursing and the general nurses rather than research nurses?
Yes, absolutely. So obviously we're starting at undergrad level, and the increase that all of you guys have really worked towards to provide more research placements, that's just been incredible. And we've also got lots of students who are needing to make up hours because of COVID and so on. So the ways in which you've come forward, that's fantastic. Research, a bit like evidence-based medicine, there's been such an emphasis in curricula on actually that evidence-based practice, but actually how you deliver research hasn't been part of that. So there's a whole lot of initiatives being developed for undergrad, but it's then moving forward. We don't have the same training programs post-grad as you do in medicine, so embedding is a bit more piecemeal. But again, if we can come up with the products, if you like, the toolkit, that'll help. And importantly, the research part of the matron's handbook, which is for every matron working clinically, the research part of that is currently being reworked, led by Nicola Verstralen and a team. And that's going to be much more toolkit focused to say, this is how you can do this, to bring it to life.